Come analyze the right to life against the right to bodily integrity. Let's see which approach aligns with your intuitions. A woman, anticipating that she would want to become pregnant later in life, underwent an IVF procedure. This resulted in the creation of 100 embryos. She chose to produce so many because she hoped to have many children, and had been warned that her embryos were of low quality and might not be viable. However, tragedy struck. She was diagnosed with uterine cancer. As a result, she now had 100 embryos in a state of dependency, yet no longer possessed the capacity to gestate them herself. These embryos required another entity to facilitate their development. Driven by a sense of moral obligation and being a doctor herself, she decided to implant these embryos into her patients while they were under anesthesia. She believed that the embryo's right to life outweighed her patient's right to bodily integrity. In her view, this moral imperative superseded her professional obligations as a physician. She acted with urgency, having learned that the frozen embryos had only 2 years left before they would inevitably degrade and perish. Was she morally justified in doing so? Would you legally prosecute a doctor who did this to save lives? Consider the following. The doctor implanted embryos into anesthetized patients without consent. This constitutes a violation of bodily autonomy and informed consent. She acted based on personal moral beliefs, not medical protocol. This breaches her professional duty and medical licensing standards. The patients were unaware and unable to refuse the procedure. This could be classified as battery or assault under criminal law. The embryos were artificially created and placed in dependency. Their right to life does not legally override the rights of living, autonomous individuals. She used human tissue without authorization. This may trigger bioethics violations and civil liability. Her urgency was based on embryo degradation, not patient health. The motive does not justify the means under legal scrutiny. So, would you prosecute? Is moral conviction enough to override consent? Should dependency and decay of embryos justify violating another person's body? Does saving lives include coercive use of others?